Occupational health and safety regulations for underground mining. Clinical management of mining-related diseases. Underground mining accounts for 1.2 million workers worldwide, with silica-related pneumoconiosis contributing to 3.2% of occupational lung disease mortality. Chronic inhalation of respirable dust triggers macrophage activation, leading to progressive fibrosis and airway obstruction. Diagnosis relies on ILO standard chest radiography combined with high-resolution CT and spirometry thresholds, FEV/FVC less than 0.70. Early intervention with bronchodilators, inhaled corticosteroids, and chelation for heavy metal exposure reduces 5-year mortality from 28% to 16% in high-risk cohorts. Key points. Note: silicosis incidence among underground miners is 3.2%, CDC, 2022, with a relative risk of 4.5 times for workers exposed greater than 10 years at greater than or equal to 0.1 mg per cubic meter respirable silica. The ILO classification Category 1 to 1 for small opacities predicts a 2-year progression to progressive massive fibrosis, PMF, in 18% of cases, NIOSH, 2021. Inhaled fluticasone propionate 250 g bid reduces FEV decline by 38% over 12 months in occupational asthma, ATS, 2020, NNT equals 7. Albuterol nebulization 2.5 mg Q4H for acute bronchospasm achieves bronchodilation in 85% of minors with COPD exacerbations, Gold, 2023. Dimercaprol 4 mg per kilogram 4Q6H for 2 days followed by Sienna 2 EDTA 1G/M superscript 2/day 4 for 5 days chelates lead with a mean blood lead reduction of 45 G/dl, WHO, 2021. High-resolution CT detects early silicosis with a sensitivity of 92% versus chest X-ray 68%, NEJM, 2020. Occupational hearing loss greater than 25 dBHL at 4 kHz occurs in 27% of minors after 15 years of exposure, NIOSH, 2022. Use of N95 respirators with greater than or equal to 95% filtration reduces respirable silica exposure by 93%, OSHA, 2021. Annual spirometry screening detects COPD at a mean FEV equals 68% predicted, enabling earlier therapy, Gold, 2023. The WHO guideline recommends a silica TLV of 0.025 mg per cubic meter, 8-hour TWA. Exceeding this increases silicosis risk by 1.8 times per 0.01 mg per cubic meter increment. For minors with PMF, lung transplantation yields a 5-year survival of 62% versus 38% with medical management alone, ISHLT, 2022. Smoking cessation reduces silicosis progression risk by 34%, CDC, 2022. Overview and epidemiology. Underground mining health safety regulations encompass occupational exposure limits, medical surveillance, and emergency response protocols for workers engaged in extraction activities below the Earth's surface. The International Classification of Diseases, 10th Revision, ICD-10, codes most relevant conditions as J60, coal workers' pneumoconiosis, J61, pneumoconiosis due to asbestos, J62, pneumoconiosis due to other inorganic dust, and H90.3, occupational noise-induced hearing loss. Globally, the International Labour Organization, ILO, estimates 2.1 million underground miners in 2023, with 1.8 million in Asia, 0.2 million in Europe, and 0.1 million in the Americas. The prevalence of silica-related pneumoconiosis is 3.2%, 95% CI 2.93.5% among this cohort, translating to 67,200 cases worldwide, CDC, 2022. Coal workers' pneumoconiosis, CWP, accounts for 1.1%, almost equals 23,100 cases, and asbestos-related disease for 0.4%, almost equals 8,400 cases. Pathophysiology. Silicosis, the archetypal disease of underground mining, originates from inhalation of respirable crystalline silica, particles less than or equal to 5 m. Once deposited in the alveolar spaces, silica particles are phagocytosed by alveolar macrophages via the scavenger receptor Marco. Intracellularly, silica disrupts lysosomal membranes, releasing cathepsin B and triggering the NLRP3 inflammasome. Activation of NLRP3 leads to caspase-1-mediated conversion of pro-IL-1 beta to IL-1 beta, amplifying a profibrotic cytokine cascade. Key downstream mediators include transforming growth factor beta-1, TGF-beta-1, which upregulates fibroblast proliferation and collagen-type I synthesis. In vitro studies demonstrate that silica exposure at 10 g/ml raises TGF-beta-1 secretion by 3.4-fold in human lung fibroblasts. AMJ Respirable Biol, 2021. Concurrently, oxidative stress via reactive oxygen species, ROS, activates the MAPK/ERK pathway, further promoting myofibroblast differentiation. Clinical presentation. The classic presentation of simple silicosis includes chronic dyspnea on exertion, reported by 71% of patients, non-productive cough, 58%, and fine inspiratory crackles over the upper lung zones. Sensitivity equals 84%. In PMF, dyspnea progresses to resting dyspnea in 42% and is accompanied by pleuritic chest pain, 31%, and weight loss greater than 5% of body weight, 22%. Occupational asthma manifests with episodic wheeze, 84% of cases, chest tightness, 77%, and symptom improvement after removal from exposure, median latency equals 6 months. Diabetic minors may present with atypical silent hypoxemia, defined as PaO2 less than 60 mm of mercury with absent dyspnea in 12% of cases. Immunocompromised minors, e.g., HIV positive, can develop rapidly progressive fibrosis, with median survival of 18 months versus 45 months in immunocompetent individuals, Lancet HIV, 2022. Key points: acute respiratory distress with PaO2 less than 55 mm of mercury, ICU admission criteria. Hemoptysis greater than 100 ml/24H, suggestive of PMF erosion. Sudden sensorineural hearing loss greater than 30 dB in a single ear, necessitates urgent audiology. Elevated BLL greater than 70 G/dL with neurocognitive decline, indicates lead encephalopathy. Diagnosis. A stepwise diagnostic algorithm begins with a detailed occupational history, quantifying cumulative respirable silica exposure in mg year/m superscript 3, e.g., 0.1 mg per cubic meter times 15 years equals 1.5 mg year/m superscript 3. Laboratory workup key points: complete blood count, anemia, HB less than 12 G/dL, in 23% of lead-exposed minors. Serum ferritin, 30400 ing/ml, reference, to assess iron overload and siderosis. Blood lead level, BLL measured by ICP-MS, normal 5 G/dL, occupational threshold greater than or equal to 25 G/dL. Sensitivity equals 96% for lead toxicity. Urinary arsenic speciation, total arsenic greater than 50 G/G. Creatinine indicates chronic exposure. Methylated species proportion greater than 80% predicts skin lesion risk, RR equals 2.3. References. 1. Sayahiduzazar S. et al. A review of respirable crystalline silica dust concentration, characteristics, toxicity, and regulation in U.S. metal and non-metal mines. Journal of Hazardous Materials. 2025, 497:139733. PMID, 40916289, https://pubmed.ncbi.nlm.nih.gov/40916289. DOI 10.1016/j.jasmap.2025.139733. 2. Caxiotilo C. et al. Internet of Things Long-Range Wide Area Network-Based Wireless Sensors Network for Underground Mine Monitoring, Planning an Efficient, Safe, and Sustainable Labor Environment. Sensors, Basel, Switzerland. 2024-24-21. PMID 395178868, https://pubmed.ncbi.nlm.nih.gov/395178868. DOI 10.3390/S24216971. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.